Hey guys, we're back. We're going to talk about something a little different today. Most of these talks so far, we've talked a lot about various aspects of pregnancy and testing and all these kind of things. And, sometimes you just don't want to get pregnant. Maybe you're looking to have some time after your last baby, or maybe you're not ready to have babies at all yet. So, let's get started. If you're single, if you're not in a relationship where you know everything is okay, condoms are always a really good idea to reduce your risk of infections. Everybody knows that, but it's just worth saying. I like to talk with people about their time frame. How long are we talking about here? Are you thinking that you're just trying to put a year or two between babies? Are you looking for something that's going to last years and years? Are you completely done having kids? All these things play a role in sort of what might be the best choice for somebody. Medical history is really important. There are some types of medical issues that make you not a good candidate for one type of birth control or another. A good example is if you are over 35 and you smoke. It actually increases the risk of blood clots and strokes in those people. Now, birth control pills in general can do that. But if you're over 35 and you're a smoker, the risk is even higher. Some people have a family history or a personal history of blood clots themselves, maybe after childbirth or after surgery or something like that. Those are also people who should not be on birth control pills or other products that contain estrogen, at least, as that may increase their risk of a blood clot again. People who have high blood pressure, especially uncontrolled high blood pressure, should avoid birth control pills or other products that contain estrogen as well, as this may exacerbate their hypertension. Say we've gone through all that. There's no medical history. You're talking about an otherwise healthy person. They don't smoke. No history of any of these bad things I've been talking about. Then I start with just big picture. Big picture is time frame and how do you want to get your birth control in your body. The first question I usually ask somebody beyond their time frame is, do you feel like taking a pill every day or not? Because basically you can break it down into daily options versus non-daily options. Daily options, obviously, that's primarily a birth control pill. Works great, got to take it every day. If you don't take it every day, it's not going to work. So if that's a problem, it's not the right choice for you. There's a million different birth control pills, and I'm not going to bore you with talking about every single birth control pill there is, because that would bore me just as bad as it would you. If you're not thinking of daily option, then we're talking about non-daily options. And that breaks into sort of short-term non-daily option and long-term non-daily option. The short-term example of that is the nuvaring. This is a little vaginal ring. It releases the same type of hormones as a birth control pill does, estrogen and progesterone. And for some people, that works great. They like it because they don't have to take that pill every day, but they get some of the same benefits that people who take birth control pills do. And those are less menstrual flow, less chance for ovarian cysts. And in both these cases, you can reduce someone's risk of uterine cancer and actually even ovarian cancer by using these long term. So those are good options if those are risk factors in your family and you're not ready yet to do any kind of definitive surgery to reduce that risk. The main side effects of both birth control pills and the nuvaring are related to the hormones: weight gain, moodiness, acne, decreased libido. Most of the time they don't. The nuvaring, you use it, it's a vaginal ring. It stays in the vagina for 3 weeks per month, 3 weeks out of 4. During that 4th week, you have your period when you take it out and throw it in the garbage. Don't reuse it. I had a patient one time say when the nuvaring first came out, I love this nuvaring, it's great, but I'm really getting tired of washing it off and putting it back in every 3 weeks. Don't do that. If you're not interested in combination birth control with either pills or nuvaring, then you're thinking more long-term options. Long-term birth control methods, primarily you're talking about either depo-provera, which is an injection that's every 3 months, or the nexplanon, which is a little rod which goes in the arm and releases progesterone, or an IUD. So we're going to talk about each one of these individually real quick. The downside of depo-provera is you have to get a shot every 12 weeks. And nowadays, a lot of offices may not even stock depo-provera anymore. And so what you have to do is actually get a prescription filled at the pharmacy, take it to the doctor's office, get the injection done, or do the injection yourself if you're able to do that. The main side effect, weight gain and moodiness. I see it a lot. And definitely if you have a patient who has depression, I very strongly caution them about depo-provera. It's known to aggravate depression. Although the injection is given every 12 weeks, it seems to hang around in your system, or at least the effects seem to hang around in your system for quite a while. I've had some patients where they had just a couple of shots of depo-provera who then didn't have a period for a year. That is one of the nice things about depo-provera. You won't probably get much of a period, at least not for the majority of the time. You may see a little bit of bleeding before your next shot. But I have seen patients who then ready to try to get pregnant, stopped using the depo, and it took them a year to get normal periods back. So keep that in mind as well. If you're thinking, I want something short term that I can stop and I can get pregnant right away, depo-provera is probably not a good choice. Nexplanon is a little rod that's inserted right in here in your arm, and basically like a shot. So just kind of clean off the skin, numb it up, and it comes preloaded in a syringe. You just inject that right underneath the skin. It's good for 3 years. The progesterone is different in Nexplanon than what was in depo-provera. You don't tend to see as much complaints about moodiness, weight gain, acne, stuff like that. But what you do tend to hear a lot about is irregular bleeding. I've had some people say, I bled every day the whole time I had that thing in my arm. I hated it. So if you have irregular bleeding to start with, this might not be a good choice. It's a great choice for teenagers if they're sexually active, or people who just don't want to have to worry about it for 3 years. You just stick the thing in there and you're good. The other big category is intrauterine devices, IUDs, and basically you can break those up into hormonal IUDs and non-hormonal IUDs. They are all extremely effective. They are all in that 99 point whatever effectiveness category, but I do see a little higher rate of pregnancies with the non-hormonal IUDs. That's the Paragard. And the majority of those that I have seen have been in a situation where the pregnancy occurred and when we saw the patient to get the IUD out, the IUD was very low in the uterus or even down in the cervix. It's probably not as effective when it's in that position, obviously. So you have to be careful about that. You can feel for the string, but you don't always know that the position's right. So I think there's maybe a little higher risk of pregnancy with that one. But it's non-hormonal. Some folks like that because they don't want to worry about the potential for some of these hormonal side effects we've been talking about. One thing for sure is you tend to see heavier periods. So if you have heavier periods to start with, the copper IUD might not be a good choice for you because it's probably going to make them heavier. But if you're okay with that, it's great birth control. Just know the bit about the positional aspects of it because I think it does have a little higher failure rate if it moves. The other category of IUDs is hormonal IUDs. There's 4 or 5 different name brands right now that are effective anywhere from 3 to 5 years. They all use a low dose of progesterone as the hormone that is released slowly from the IUD into the uterus. You tend to see less overall effects in the body, so less complaints about moodiness, less complaints about weight gain and acne, because there's only a small amount really getting into the bloodstream. You will still see some people complain about that. And what I tell them is, hey, give it a shot, and if you hate it, you can always take it out. The nice thing about the hormonal IUDs, though, is it tends to make your periods lighter. So if you have heavy periods, it's a great choice, especially if you don't want to take a pill every day. If your periods are already pretty light, then you might have no period at all while you're on the IUD, and as far as I'd be concerned, even better. So that's a great choice if you're thinking long-term, especially if you have heavy periods. Really great choice if you've had kids and you're trying to space between deliveries. So we put a lot of these in at postpartum checkups after mom just came back in after having a baby. They're really easy to insert at that time. The uterus just really doesn't even seem to care. You just had a baby, so what's this little IUD? At that point, it's virtually painless. For people who have not had kids, it can be crampier. They're still very doable. There are IUDs that are smaller and are meant for people who have not had kids yet. They're a little easier to insert and perhaps a little less painful. So all these are great birth control choices. There are other methods, of course, as well. There's natural family planning, which in my opinion is kind of like going like that. But if you do track ovulation and you are consistent with your periods and you know when you ovulate and you avoid that time in your cycle when you're most fertile, it definitely reduces the chance of pregnancy. But I would never say never. Other barrier methods like the diaphragm or the female condom, they work. They work about the same as a condom does. They probably don't reduce the risk, or at least the diaphragm doesn't reduce the risk of STDs like a condom would. And they're non-hormonal, so if you like that aspect, that's good. They're kind of messy and have to deal with them in terms of insertion and removal and all that. You have to be fitted for them, and there's probably less and less places you can find that will be able to fit you for a diaphragm nowadays. Any of these are good choices. Any one of these, if used correctly, dramatically reduces the chance you're going to get pregnant. It's really a matter of your personal preferences, any medical considerations, and the time frame that you have in mind for how long you'd like to have birth control for. One thing to say about that IUD I meant to mention before, the IUD is immediately effective when it's inserted, and it's immediately reversed when it's removed. Some people think you have to leave it out for a certain period of time. That's not true. That's also equally true with regard to birth control pills, nuvaring, and even the nexplanon. When you stop using those things, your fertility returns essentially immediately. So there's this myth that you need to be off of your birth control for months or whatever to try to get pregnant. It's just not true. I hope this is helpful to sort of guide you through a thought process about how you might choose a method of birth control. If you have questions, please put them in the comments below. And thanks for watching. We'll see you next time.